first and foremost, if we suspect that there's any degree of mast cell activation or histamine intolerance, we want to screen for it appropriately. And we do have some screening measures that we can do, and we want to help patients advocate for themselves, potentially for further evaluation for this with their primary care physicians. But from a rehabilitation standpoint, if we suspect that someone has mast cell activation or a mast cell activation disorder, we want to ensure that that we're helping patients manage their triggers. One trigger can be exercise or activity and movement. So we want to ensure that if we're making any sort of recommendations, that we're being very gentle and very gradual and respecting that kind of hypersensitive system. We can help patients try to identify their triggers to help them reduce their flares, but then also helping them generally with some of the basic energy management strategies in physiotherapy can help kind of desensitize their system and help to reduce kind of the number of flares that they have day to day. There are a number of ways that registered dietitians can support patients with post-infection conditions, looking at a broader kind of diet that helps to support reduced inflammation in the body, as well as identifying if there is potentially MCAS or histamine intolerance, and helping patients safely administer a low histamine diet as a trial, as well as ensuring that patients are meeting their basic nutrition needs, and also helping to workshop ways to meal prep and make food when energy is limited. And our dietitians are very good at all of these things. If you think that you might have a post-infection condition, would be to reach out to Cornerstone and book an initial assessment with one of our physiotherapists. In that initial appointment, which is 60 minutes long, we'll go through a full clinical history, past medical history, and look at sort of what your day-to-day symptoms look like, what your day-to-day function looks like, and kind of help hopefully give you some answers. We might not be able to give you all the answers you need right away. We need that sort of more lengthy conversation to get started.